Okay, so lumbar spine examination, right? So warm, first temperature. Okay, temperature maybe you can use, but temperature is something you measure, right? So look, warm. So how will you palpate warmth? Okay, yeah, dorsum. So you can break into 6 regions. Okay, 1, 2, 3, 4, 5, 6. Cervical, thoracic, and lumbar. So you just palpate. Okay, so you palpate. Some people want to use both arms, but remember, using single hand will be more reliable because the sensitivity will vary in both hands. So you want to just use one hand. Okay, so just check for warmth, ruling out any infective causes. Okay, osteomyelitis of the spine or something. You want to rule out. Then what do you do? Paraspinal tenderness. What is paraspinal? It means the muscle just beside the spine. Okay, so you just palpate, see if there's any muscle spasm, okay, tenderness. Okay, you want to rule out any musculoskeletal cause. Low back pain, one common cause is musculoskeletal, right? In GP, if you work, most of them will come and it will be usually musculoskeletal, but of course you have to do that, so you have to do a complete examination. So you just, and you won't be able to see dryness. So here you have to ask the patient if he's actually having any pain, because you won't be able to judge by his expression. So you just palpate. Then you palpate for the bone. So bony palpation, you use what? Thumb. So you just palpate. You can do this like what one of you say. Okay, palpate. Okay. So in the case of lumbar spine pathology like spondylosis, prolapse intervertebral disc, so they will, let's say you're palpating around here. Suddenly he says there's pain. Okay, there's pain here. So what's the significance? So pain means the pathology is around there. Right? So you don't stop there. Now you go to deep palpation. What do we mean by deep palpation? Deep palpation, like we want to estimate the level of lesion. See, I don't want to just know that he has pain over the lumbar region. Then even the patient can tell me. I want to estimate the level of lesion and see if it tallies with my examinations after that. Because after this, I'm going to look for tone, power, reflex. So I want to see the myotome, dermatome, and all other findings, the reflexes, tally with the estimated level of lesion. So I want to just have an impression, an estimate, so that it serves as a guide whenever I do the examination. So I can anticipate something. Right? So how will I know where's the level of lesion? From here, let's say he has tenderness here. This is very painful here. How will I know what level is this? Okay, so where's iliac crest? So the highest point, don't confuse iliac crest with ASIS. Okay, so the highest point of the pelvis, okay. So you palpate for the iliac crest, then you, so bilaterally, and then you see where your thumb joins. So you trace posteriorly from the iliac crest. This is called a supracristal line. Okay, so what level is this? When I trace from the supracristal line, from the iliac crest, what level is my thumb meeting at? So I press here, right? So iliac crest, I palpate. Okay, so I palpate one spinous process here. So what is this level? Yeah, L4, L5. So what do? I palpate, ask if he has pain. Then I go one spinous process above. What is this? L3, L4. So from the iliac crest, if I go one level below, that will be L5, S1. So accordingly, I run through a few levels and ask him where's the highest level of tenderness. That's my estimated level of lesion. So let's say if I palpate at L4, L5, he has mild pain. L3, L4, he has severe pain. Okay, so my estimated level of lesion, and of course, let's say L3, L4, he has the severest pain compared to every other possible levels. So I'll keep L3, L4 in my head. So when I'm going to examine tone, power, reflex, so I'll be very careful when I'm examining the myotome for L3, L4, dermatome for L3, L4. Because I've anticipated, if my palpation is really accurate here, I will anticipate that